So we're going to now move on to a key issue in life with diabetes and the potential stigma that people might face. It is also one of our sort of most popular topics, and that's food. So Professor Christie is going to stay with us, and we're going to be joined by health coach Erin Dolan and diabetes specialist dietitian Mark Green.
I'm Mark. I'm an advanced diabetes dietitian working with inpatient and outpatient people living with diabetes. Also run a YouTube channel and a blog called the Diabetes Diet Guy, which is just designed to give people advice and information about how to manage those tricky glucose levels.
Thank you. And Erin?
Hi, everyone. I'm Erin, and I am a diabetes health coach and also a FreeStyle Libre ambassador. I have been living with type 1 diabetes for over 30 years now, and I offer advice and support for people with diabetes on mental health, nutrition, and lifestyle. And I'm originally from America, but I'm living in Ireland. But you can connect with me on Instagram and Facebook at Crazy About Diabetes.
Thank you so much. So the quick question that we're going to kick off with is, because I'm quite keen that we sort of cover both types, and this is open to anyone, are there different types of stigmas, or do people make different judgments about the food choices of people who are living with type 1 or type 2 diabetes? Deborah, you're nodding. I don't know if you've got something you want to say.
No, I'm going to let Mark go first.
Okay.
Thanks, Deborah. I mean, I think we've kind of touched on it with the education side of things. So I imagine these stigmas do exist, but I think the classics are, should you be eating sugar? Can't be eating carbohydrates, which is pretty rife on social media from what I read. So I think there's definitely similarities, but as people start to understand the condition slightly, particularly in healthcare, I think there's definitely arguably a bigger stigma to type 2 diabetes. Although it's incorrect mostly, I think it might be seen a bit more as self-inflicted or lifestyle related, which isn't the case. There's many reasons for it, but I'll hand over to Erin because I don't want to rattle on just too long.
Thank you.
Yeah, definitely those misconceptions about, it's maybe it's caused by eating too much sugar, or you can't eat any sugar. But I often find too that sometimes people group diabetes together. So maybe when you tell somebody that you are diabetic and you're eating something, they may just say, oh, well, you shouldn't be eating that. And just to give an example, I was recently at a family event, and we're all sitting down with a dessert, and my niece looks at me and also a family friend who has type 2 diabetes and I have type 1. And she said, oh, well, you shouldn't be eating that. So it just goes to show you that some people just don't understand the differences in the diabetes and the treatments and how many different types there are.
Mm-hmm.
Thank you.
I mean, Poona, I think it's just worth quickly adding that there has been research done looking at this, and what they found is that with type 2 diabetes, you're going to kind of get a double whammy. With type 2, you don't just get the diabetes stigma, you also get weight stigma. So, and that then creates a vicious cycle, and that's why you get more disordered eating in people living with type 2. So there is definitely a double whammy for type 2 compared to type 1.
Yeah, and well, actually, off the back of that, there's a question that's come in specifically for you, Deborah, which is from one of the audience members, which is, how can I deal with judgments around food choices and a lack of understanding when I don't want something?
Well, I think one of the things is that it's very hard, isn't it, to be assertive in certain situations, and often in public, you're going to be embarrassed if you cause a scene. You're worried that you might say something and somebody would get upset. We also get upset about correcting people because they might get upset. So we get stuck in this horrible vicious cycle of well, I don't want to say anything to correct them because then they'll be upset, and so everybody gets upset. I think if people are being judgmental, finding the right time to say something can be helpful. It depends on how well you know them. If it's a stranger, I think you're more at liberty to sort of say, hey, I don't know you, so I'm, thanks, but no thanks, don't want your advice. I think if it's like, with Erin, your niece says something to you, my 10-year-old granddaughter says things to me that, like, really, grandma, should you be wearing that? you're 10 years old. Should you be saying that? So I think there's also, you know, and humor can help sometimes, but dealing with judgy behavior is very tricky. And I think there's something about, I would always say to people, go for some coaching, learn to be more assertive. Go and see somebody and learn about your own assertiveness. Learn how to be comfortable in your own skin. Because if you're comfortable in your own skin, then if somebody says something to you, you can kind of brush it off. If you're not, what happens is it soaks in and then you're stuck with it.
Yeah.
So it's kind of learning to be able to stand and to pull your shoulders back and go, this is me. And so nothing you say sticks or matters to me. And that sometimes is difficult on your own, but a bit of coaching, a bit of psychology, some great dietary advice, all of those things will help you feel more confident in who you are. And that's where you need to start.
Thank you. So we've had a couple of questions just following off that, which I think can actually be wrapped up into one. So one person has said, you know, how can I respond to teasing questions like, oh, well, this is a lovely cake, but you can't eat it. And then the second question has come up, which I feel follows on very nicely from that, is how can I be confident with my diet choices? So really, I suppose what I'm asking there is, there's one question that's come in around the actual stigma that you can face, but also that other internal work about how that might impact you and how can you be more confident with that. And Erin or Mark, I don't know if you want to jump in and take that.
Sure, I can start. And I think the big thing is, you know, going to Deborah's comment about being silent or being angry. I think there is just this lack of awareness about diabetes and what kind of food, you know, people with diabetes can eat and the flexibility that, you know, they can have. So I think by being able to share your story and how with your diabetes you eat food and using your treatment method, and also even diabetes technology, if you're using diabetes technology, you know, show them, educate them, and just so you can provide more awareness to them so that they won't make these jokes again. And they have the knowledge so that, you know, this isn't, you know, you're not going to eat this and get diabetes. You know, there's those jokes they're not nice to have, and they're not nice to hear. So I think by bringing more awareness about diabetes and, you know, how you can work with your food choices, is so huge, so that it's like a ripple effect, you know, then they won't make these jokes again. But also by understanding, for if you have diabetes, by understanding your food better. So maybe that's knowing how to read food labels, you know, looking out for ingredients and the red flags, like the different types of sugar, knowing how to count your carbs so that you can implement more carbs and you know what kind of carbs there are, you know, your white rice versus your brown rice is going to be a little bit better than your white rice or your processed foods. So it's just learning more about, you know, carb counting and what carbs are, and that education so that you can implement more foods and try different things, and even, you know, going out to socialize with friends and family, and not have that fear that because of diabetes, I'm not allowed to go out and I'm not allowed to, you know, indulge a little bit.
Thank you. Mark, have you got anything you'd like to add? I've actually got quite a specific question for you afterwards. So I just wanted to, is there anything that you wanted to add about being confident around the food?
Well, I think Erin's done a pretty nice summary. One thing I'll put at is, you know, I think everyone seems to have this conception that we need to be 100% all the time. And actually, no one's perfect. No one achieves perfection. So, you know, we're looking for a good average. And if you're confident that you can do that and get the support in place to do it, you know, you're in a good starting point. So don't put too much pressure on yourself.
Paulie, there's also something about intention, which I think is maybe can help you manage that confidence and the response issue. So I'm thinking sort of like with Erin's niece, you know, I don't know how old your niece is, but when somebody might say something to you, it's because they're concerned about you.
Yeah.
So it's a teaching moment. Gosh, you know, and to say to them, gosh, it's really nice of you to worry about me like that. Isn't it great that actually I can eat this? And the reason I can eat this is because I manage diabetes by having some of this medicine after I've had some cake. So, but thank you ever so much for worrying about me. And that's just a nice way to deal with it. And I think if you can try and look out for it and think, can I turn it around so that I assume their intention was good, rather than it being a sort of nye kind of thing. That then also allows you to leave that interaction feeling better as well.
Thank you. Mark, a question has come in about how do I manage type 1 with being celiac? I'm finding it really hard with being gluten-free.
God, well, I can sympathize with this individual, because if it's not already enough to think about with type 1, then you have to add on the gluten-free on top of it, which some people do have to deal with. I think in terms of managing both, with regards to the type 1, the celiac, the non-gluten products are still carbohydrates. So in terms of managing the type 1, it's the same principles. If you're carb counting, then we need to count the carbs and then use your ratios with your insulin to then match the insulin to the carbohydrate. But that principle doesn't change. But I do appreciate that it's another consideration with the celiac. If you're really struggling, I'd encourage you to work really closely with your diabetes team. If you don't have a diabetes team, reach out to the GP and see if you can get referred to more specialist input, because it's the sort of thing that does require someone just to sit there and work with you one-to-one, as opposed to general advice, unfortunately.
Thank you. There has also been another quite specific question that has come in, and Mark, I'm going to ask this of you, but Deborah or Erin, if you have any thoughts, please do. Please do come in. So this person has said, I'm a type 2 diabetic. It's well controlled up until I had a COVID infection. Now my sugars are out of control, and I'm trying to minimize carbs, but any recommendations on how to deal with this?
And we see a lot of COVID in the hospital, and it has been very difficult to manage. COVID in itself seems to exacerbate the insulin resistance that patients might be experiencing in the first place, which can really set their sugars off. If this person is minimizing the carbohydrates that they're eating, then presumably if the sugars are going high, it's not dietary related, and therefore it probably means that if they are taking medications, or maybe they're not taking medications, it might need someone to take a look at this as well and actually see what that baseline glucose level is and how that's progressing throughout the day, because in this particular instance, it's not always diet that's the culprit.
Okay, thank you. And another question, which could be for all of you, which is about the fact that when you're thinking particularly about food, and I know we've sort of touched on this a little bit earlier in our discussion, but when you're thinking about food, and Mark, I know you said that no one can really do 100%, but do you have any tips or advice to make sure that when you are facing external stigma around food, that you can have a positive relationship with food? And if anyone wants to go first, Deborah or Mark or Erin.
I can talk about that. I think one thing is if you are using diabetes technology, this can help you with this external stigma, because you can show people how your technology is working, and allow them to see that you're getting a big picture of your glucose numbers, and that you have greater transparency with your technology. So whether it's the flash glucose monitoring or CGM, that you can actually see an overview of your glucose numbers before you eat and after you eat. And I suppose the other thing is allowing people to know that you are able to eat different types of food, and that you can try new food, and I suggest everybody with diabetes to not try to stick to the same thing every single day, because I think it goes back to Deborah earlier in her discussion when she says there's this internal stigma. I think people with diabetes have that internal stigma that they, especially at diagnosis, that they have to eat the same thing, or maybe they have to have a high protein diet. They can't eat any carbs. So sometimes that gets into our mindset, and we can't change these bad habits. So I think by allowing yourself to try new foods, and seeing how your glucose numbers react, and checking them before or after using your technology, that it actually helps you with that external stigma. and helps you kind of have a better relationship with food as well. And now, you know, there's so many recipes out there. You can get them on social media and cookbooks, and most of them have nutritional information. And also you can adapt recipes to make them a little bit more blood sugar friendly.
Thank you. Mark or Deborah, do you have anything you want to add before I move on?
I guess I would just say that everybody has a tricky relationship with food. Food is so part of our culture. Every single thing that we do in our cultures, it doesn't matter which culture you come from, everything is marked by food. And whether it's a christening or a Christmas or a Diwali or an Eid festival or anything, it doesn't matter what it is. The food is going to be part of that. Mm-hmm. And so having a good relationship with food is key for everybody's mental health, and being able to get good advice. So I would say, you know, having good advice from a holistic diabetes team. So not just focusing on insulin, not just focusing on that, but say to the diabetes team, I want to make sure I talk to the dietitian because I want to think about what's good, what I can eat, what I can't eat, what's going to push my sugars up. So if I eat it, I know how to manage it. Talking to somebody from the emotional well-being side, counselor or a psychologist or a psychotherapist, talking to them about, you know, how do I feel about food and the way don't let it control you. You control it. And that's where people get into trouble, when the food starts to control them. Mm-hmm. So that's the thing that you've got to keep remembering. You're in control of the food. It's not in control of you, but you need to have everybody involved.
Thank you. Before we move on to the last question, I've actually got quite a specific question for Mark, which is, with regards to food, are there any positive foods that promote insulin absorption or provide energy, but without rocketing your sugars?
Wow. Okay.
That's an easy one, Mark.
Magic food.
So, no real evidence to suggest that there's any foods that would promote insulin absorption, so to speak. And by insulin absorption, I suppose in the body, you're not really absorbing insulin. Insulin is a hormone that's sending messages to the body to absorb the carbohydrates. In terms of getting energy without rocketing sugars, depends on the patient, depends on the type of diabetes. Obviously, in type 1 diabetes, it's about replacing the insulin that your body would otherwise make. In type 2 diabetes, they have a slightly different consideration, that they are dealing with potentially an insulin resistance, where they're not going to be able to process the carbohydrates like they previously could before the diagnosis. So in that respect, and if you're finding you're getting high glucose levels after eating, then it might mean that we choose something that's more slowly absorbed, so lower glycemic index, maybe taking away some of the carbohydrates at the meal and replacing it with lower carb options like vegetables, protein sources. So I don't think we need to get as specific as that necessarily, and actually we can just rely on more easier to dissect messages like more vegetables, lean proteins, and manage the carbohydrate portions well. Otherwise, I think we'll drive ourselves crazy. But I do appreciate the question, and I hope I've done it justice and understood it properly.
Yeah, I'm going to sneak a very quick question in there. Just off the back of what you've just said, what are your views on low carb diets?
Yes, so I think it depends on what context we're looking at it in. So there's no real definition of low carb in the first instance. There's very low carb, which is keto. That does have a definition, typically below 50 grams a day. Mm-hmm. Low carbs, anywhere between 50 and 150, typically. Excuse me. So there is evidence to show that in type 2 diabetes, when we follow a lower carb diet, that the glucose levels and HbA1c tends to be better. Not as much evidence in type 1 diabetes, although anecdotally, I do see some results. But when we're looking from general health, actually no diet tends to be better than the other. My one concern with low carb diets tends to be often the thing that's sacrificed is the fiber intake. And actually there's a body of evidence, like probably the most widely studied thing in nutrition, to show the benefits of a high fiber diet. And so if we're sacrificing the fiber in the diet to then control the glucose levels, we might be ticking one box, but actually we're putting a big cross in another.
Okay, thank you. We've got time just for one last question, which I'm going to ask Erin to answer, if that's okay, which is, I'm going to give you the context super quick, which is, how would you recommend overcoming your own prejudices or self-perceived stigmas? And I think the context is from someone who has diabetes, who may have stigmas that they've kind of absorbed as well.
Yeah, so I suppose for me, maybe not just thinking about the food side, but just in general, self-stigmatizing. For my journey of the past 30 years, it has been ups and downs, embracing my diabetes and then hiding it away. And I think, as mentioned earlier, is that, over the years, new challenges come with your diabetes. And I was diagnosed when I was age 10. So we talked about, being different and not wanting to be different. And that was a huge thing in my teenage years, is that I definitely didn't want to feel different. So I hid it. And then I was able to embrace it by meeting more people with diabetes and opening up that dialogue and seeing that, like, I'm not the only one with diabetes. And then going through my college years and wanting to, be free and hide it again. So my biggest thing is that I had to push my boundaries and maybe push things that I thought I couldn't do, like a marathon. I remember saying to myself that I can't run a marathon, and I did, and I accomplished it. And, I did these things. I even cycled across Central America. So I think by setting myself goals and achieving them, knowing that, like, I can live this other life with diabetes, I don't have to limit myself. Obviously, it takes a little bit more forethought, and when it comes to food, I need to manage it, a little bit more. But I can still allow myself a little bit more freedom with my life with diabetes.
Thank you so much.